Hi, I'm Naima Samreen Ali, a second year PhD student at Vanderbilt University, and today I'm presenting our paper titled I'm Gonna Kill Myself From Imminent Risk to Youth, Joking About Suicide and Self-Harm via Social Media. This paper was co-authored by Sarvech Qadir, Ashwaq Alsoubai, Munmun Choudhury, Afsaneh Razi, and Pamela Wisniewski. This presentation discusses sensitive topics of self-harm and suicide, therefore, viewer discretion is required. Sharing self-harm content on social media for connection and support is prevalent among youth. However, it increases the risk of suicidal behaviors. For example, Instagram gained scrutiny after several suicide cases were associated with self-harm content viewed on the platform. Suicide is a growing public health concern and the second leading cause of death among youth in the US. Therefore, digital manifestations of self-harm have gained immediate and significant attention in the research community. Much of the prior work has focused on determining the key themes, patterns, and ideas about how youth interact with self-harm and suicide on social media. However, owing to the sensitive nature of the topic, youth tend to engage more in private conversations to seek support. Therefore, there is a need to understand the context of such discussions and how the respondents of such messages respond. Moreover, efforts have been made to automate predicting of self-harm and suicidal behaviors for developing preventive solutions. However, youth language often deviates from the standard patterns, posing difficulty for these detection algorithms. Subsequently, further qualitative research is necessary to ensure that automated methods incorporate a nuanced human perspective, minimizing unintended harm. Therefore, we analyzed youth private conversations to understand their perceptions and experiences about self-harm and suicide to inform future interventions for addressing suicidal risk among youth. We posed these research questions. What types of conversations do youth have with others regarding their personal experiences with self-harm and suicide on social media? And how do their conversation partners typically respond? How do youth discuss self-harm and suicide with others when talking about a third party? In what other ways do youth use self-harm and suicide language in their private social media conversations? To answer our research questions, we conducted a qualitative thematic analysis of youth's private conversations on Instagram. We utilized a dataset from a youth Instagram data donation study, which contained private conversations on Instagram gathered from 195 youth participants between the ages of 13 and 21. In the study, youth were asked to download their Instagram data, upload it to a secure web-based system, and flag their own private conversations as safe or unsafe. The participants were then asked to provide further details about each conversation marked as unsafe by labeling at least one unsafe message for risk types, that is self-injury, sexual solicitations, etc. Also, 6 undergrad research assistants were hired to label unsafe messages and their risk types in the conversations. To scope our data, we leveraged a multi-level approach. First, we identified conversations marked as self-injury by the participants themselves and the research assistants. Apart from that, we also created a search query informed by common terms indicative of suicide and self-harm in the previous literature as well as urban dictionaries. We ended up with 5,001 conversations that were later subjected to relevancy coding. The conversations were deemed relevant if they contained references to self-harm or suicide, or involved the usage of self-harm language metaphorically or ironically. This process resulted in 1,224 conversations from 151 unique participants. Each conversation was then parsed into sub-conversations. For our study, a sub-conversation was defined as a part of the conversation where self-harm discussion was the most prevalent with 4 components: initiation of the self-harm and suicide discussion, the context of the disclosure, the responses of the conversation partners, and the conclusion of the conversation, which was mostly indicated by a switch in the subject or the passing of time. Oftentimes, a single conversation contained multiple sub-conversations. We identified a total of 2,019 sub-conversations, which were used as our unit of analysis for our qualitative results. To answer our research questions, we then carried out qualitative analysis of data to create a codebook to identify the key aspects of youth discussions around self-harm and or suicide. Once the coding was complete, the research team worked together to group the codes conceptually into themes. Out of 1,224 conversations, majority were 2% DMs. Among 2019 sub-conversations, suicide was found to be the most common type of risk, often due to the use of humor or hyperbolic language. Around 23% of the sub-conversations were about youth's personal experiences and 7% were about experiences of third party, while 70% of the sub-conversations were about using self-harm and suicide language hyperbolically. While discussing personal experiences, most of the conversations were about current or future urges, posing imminent danger of them acting upon these thoughts due to different mental health challenges or relational difficulties. Peers mostly gave support by showing empathy, giving practical advice, and understanding to the best of their abilities. However, at times, they also shared similar struggles. For instance, in this conversation, an 18-year-old female participant shared her struggles with depression, and her peers said that they won't be able to provide much help as they also suffer from depression. We also came across toxic behaviors like youth being bullied to kill themselves or threatened by suicide by their friends or romantic partners, in which case youth took a stand for their peers and snubbed bullies for their bad behavior. Youth also often initiated the discussion by checking in with their peers who experience self-harm or suicidal urges to provide continued support and keep them from acting upon these thoughts. Youth confided in their new friends and romantic partners about their past behaviors to strengthen their bonds while also revisiting memories of past self-harm and suicide experiences with close people and received emotional support and validation. Youth also proudly announced that they had overcome self-harming while appreciating projects and support groups that helped during the journey to spark inspiration for others struggling with similar urges. For instance, in this conversation, a member shared how it's been 3 years since they self-harmed and their peers celebrated their accomplishment. We noticed that self-harm and suicide instances of others had a social impact on youth that was mostly manifested as sharing gossip and passing judgment on their suicidal or self-harming behaviors, like terming it as attention-seeking or causing drama. Youth advocated for their peers, emphasizing that they are often misunderstood. For instance, in this conversation, a 17-year-old participant shared about a person who is often ill-perceived as an attention seeker because he talks about suicide, while actually being a really nice person. Youth also asked for direct help in forming strategies to intervene and help youth in a crisis. For example, in this conversation, a member asked for suggestion regarding helping out a friend at risk of self-harming, and the 20-year-old female participant suggested to be cautious while informing counselors, as they might tell parents that can further aggravate the situation, and instead suggested talking to them directly and trying to pacify them. Mostly, peers suggested to just be with their friends and reassure them of their value as much as possible. Interestingly, majority of the conversations were about using hyperbolic language for killing oneself, mostly as a way to express extreme frustration. For instance, in this conversation, a 17-year-old female participant showed concern about someone thinking of her as weird, and the conversation partner casually calmed her down. They used such phrases to show immense admiration, extreme academic or professional work-related stress, response to viewed content, for example memes, and to express extreme physical discomfort. Youth also used exaggerated statements to express extreme joyousness. Mostly in these cases, respondents found these situations relatable and reciprocated with similar reactions. While talking in a general context, youth mostly raised suicide awareness by sharing certain suicide campaigns. Peers mostly appreciated the effort, but at times they also got surprised. For instance, in this conversation, a member shared a message related to participation in an ongoing suicide prevention campaign, to which the 20-year-old male participant replies sarcastically, "Do I look suicidal?" They also discussed various media content based on suicide and self-harm, like 13 Reasons Why, and discussed their impact. Youth mostly used humor directly about killing oneself or joking about suicide. They jokingly talked about shooting themselves by tweaking the term and using parachute and kashoot instead. Furthermore, in only 2 instances, self-harming humor language was used where youth were seen making jokes about cutting body organs. The respondents showed a lack of responsiveness and ignored suicidal humor as they considered it not harmful. Our study showed that youth prefer talking to peers to seek support and share their journeys of recovery. Hence, we called for realizing the importance of providing outlets for peer support in unfiltered conversations and move beyond overly censoring or policing youth and instead providing in-the-moment help to navigate such situations. When youth gossiped and passed judgments, we realized that sometimes youth knew how to set boundaries and communicate those boundaries to save mental distress. However, we call upon the need to understand how this might affect the person making a disclosure. Moreover, youth went above and beyond to support those in crisis situation, but often lacked skills to effectively help them. Hence, we can train youth on how to handle such situations while also providing them strategies to keep their own mental prowess in check. A novel finding of the study revealed that the sensitive topics like self-harm and suicide might be discussed in a humorous setting or with exaggerated references, which can desensitize the issues and can be re-traumatizing for victims of violence or loss. Hence, we need to better educate the youth to opt for milder words to express their feelings. Also, hyperbolic language can highly affect the machine learning community's algorithmic risk detection efforts by increasing the likelihood of false positives. Therefore, we need more context-aware approaches like the one we have proposed in our study to detect and dismiss hyperbole. We recommend creating safe spaces by incorporating a trusted circle feature with close friends and therapists so they can openly seek help. Also, we suggest establishing crisis intervention plans to protect at-risk youth while also utilizing robust consent mechanisms to safeguard user privacy. Moreover, we recommend leveraging a more nuanced annotation approach to reduce false positives to formulate proactive detection approaches. Finally, we suggest exploring nudge interventions for prompting youth to reconsider the language and educating them about the consequences of making jokes around sensitive topics. Our study is the first to analyze youth private conversations regarding self-harm and suicide and opens up a conversation about the dire need for partnering with younger generation to help them effectively navigate these risks. Our study urges to move beyond blaming social media for the mental health crisis of youth and instead invokes hope for working together with youth and creating solutions to effectively mitigate risky behaviors as there is no time to waste. Thank you, and feel free to reach out to me via email if you have any questions regarding our research.